I think, one of my greatest strengths is that I can really offer almost the full breadth of all treatment options for urinary incontinence, regardless of the type of incontinence. And in addition, I also bring in a skill set of being able to treat prolapse and focus on women who perhaps also have conditions like recurrent urinary tract infections or pelvic pain. Patients with any of these conditions are very different. They're different in what their symptoms are, they're different in the degree of bother it's causing them, and they're different in what they want done and what they're willing to do to have the conditions corrected. For urinary incontinence, recurrent infections, prolapse, I think there's a lot of reasons why women don't seek care. I think first of all, especially for urinary incontinence, there's a certain maybe level of embarrassment. Even when they come in to talk to me, they still are a little bit embarrassed about their symptoms, and I emphasize, this is what I do all day long. And then I think, also a lot of women want to see female providers. Being able to have access to that type of provider, female provider with interest in these areas, or even the ability to treat these areas, is also important for women. I think what I love about taking care of these women is the impact that I can have on their quality of life. Being able to get them to be less embarrassed about their condition, more comfortable just physically, can really impact, how the patients perceive themselves. I want them to know what the options are, rather than to just believe that they have to live with the condition as it is.